Hi everyone, my name is Rejoice, and once again I welcome you back to my channel. Today I will be talking about a very fascinating topic that is of a great necessity to all societies, and it is infertility. Before I proceed to the definition of what infertility is, please permit me to drop a note. Now, fertility is very essential to all societies. Infertility had been a source of pain, a source of anxiety, and a source of shame to the society. The fertile couples are perceived to be more important in the societies, while the infertile couples are being disregarded for their inability or failure to contribute or the production of children for the next generation. Having established this, now what is infertility? Infertility simply implies the inability of couples to achieve pregnancy after 12 months or 1 year of regular unprotected sexual intercourse. This simply means that the couples do have sex regularly without any form of protection, without any form of barrier. They aren't on any family planning. Yet they cannot just achieve pregnancy. And when I talk about family planning, there are different types of family planning. We have the traditional family planning, we have the natural, we have the artificial, we have the hormone, and we have the emergency contraceptive, and so many of them. Now those couples they aren't on any of those things, but yet they cannot just achieve pregnancy. That is what it implies. That is what infertility is all about. We also have types of infertility. We have the primary infertility and we have the secondary infertility. When we talk about the primary infertility, it simply implies when couples are unable to achieve pregnancy after 12 months of regular unprotected sexual intercourse. And when we talk about the secondary infertility, this simply means that couples were able to achieve pregnancy, but subsequently they have not been able to achieve another after 12 months of regular unprotected sexual intercourse. Now let's talk about some of the causes of infertility among the male. Number one is when there is a poor quality of sperm, and this is usually due to low sperm count. Number two is physical factors such as excessive alcohol consumption and excessive smoking. Over the years, there have been this lamentation warning a lot of people out there to stop excessive smoking, to stop alcohol consumption, but unfortunately it has fallen to deaf ears and many aren't ready to stop it, unknowing to them that this is causing more harm than good to their body. These can cause infertility. Number two is the wearing of tight underwears. The next is when there is lack of vitamin C and zinc in our diet. Another is when there is excessive exposure to environmental hazards. And another is when there is erectile failure or ejaculatory dysfunction. All this can lead to infertility among the male. Now let's talk about some of the causes of infertility among the female. Number one is when there is a blockage of the tube. when there is a tube blockage. All right. Another is other reproductive tract infections following induced abortions and miscarriages. We also have when there are some congenital abnormalities. We also have cervical factors. All right. Now we've been able to differentiate the different causes of infertility among the male and female. Now let's talk about some of the causes involving both the male and female. Number one is infrequent sexual intercourse. When the both couples hardly have sex together, when there is no frequent intercourse between the both couples, this can lead to infertility. Another is when there is a wrong timing of the coitus. Okay, the both couples doesn't have an idea or knowledge on how the timings are being done. For instance, they don't have an understanding of the safe and unsafe days. They don't have an understanding about what ovulation is. They don't have an understanding of their cycle length. This, when they don't have a knowledge about all of this, it will make them not to have an understanding on how to time the coitus. Okay, but when the woman or the man have knowledge about all of this, it will help them to plan well and to know when exactly to expect their child or when to fertilize the egg. Another one is aging contribute to infertility. Another one is promiscuity among the both couples. Okay, moving out with different guys out there or moving out with different women out there. This can lead to infertility because you might end up contracting different kinds of sicknesses from there. All right. Another is when there is malnutrition. Their diet isn't balanced. They just eat anything that comes to their way. This can lead to infertility. Another one is when there is anxiety. You are always scared. You are always afraid. Fear of the unknown, fear of the known. You are always living in anxiety. This can result or cause infertility. Another is when there is lack of cooperation between the both couples. They cannot just agree on a thing. They cannot just agree that we are going to have sex today or tomorrow. When there is no agreement, it will be very difficult to make a plan. So when there is always disagreement between the both couples, it can interfere with the timing of their coitus. It can interfere with their conception because they are always living in disagreement. So this can cause infertility. And the next is immunological causes, STI, the misuse of drugs. Okay, now how can this be prevented, and how can it be controlled as well? Number one is proper management of STI. Are you there and you are having STI and you've been keeping it to yourself? Probably you felt or you were feeling that it's so shameful and shouldn't be shared with anyone. Please keep it to yourself no more, but rather rush to a nearby health facility, and trust me, you will be properly managed and you'll be fine. The next is seek knowledge on sex education and the danger of STI. Number 3 is adequate diet. Number 4 is avoidance of environmental hazards. Number 5 is regular medical checkup. This will help you, or this will help in the identification of some chronic medical conditions. And when they are being identified, they will be properly managed, okay? And they will also help you to prevent all those chronic medical conditions, okay? And number 6 is be mindful of the kind of drugs you are using, especially drugs that interferes with fertility. Number 7, are you there and you are wanting to have children? Please be conscious of your age. Number 8 is couples should learn on how to develop a cordial relationship. Okay? So, with this, I am persuaded that I have shared a very informative information to anyone who is gonna come across of this video. Thank you so much for watching, and thanks so much for always returning. Now, if you were there and you want me to elaborate more on any of the points that I have listed, please do me well to drop it in the comment section, and I will be honored to give answers to your questions. And you were there and you have contributions, or you have anything at all to say, please do not hesitate to drop it at the comment section. And also help me to share, like, and comment on this video. Thank you so much, and may God bless you. See you in my next video.